PRNs, and DNP students, Elaine Pandoloro, Tony Fran, Deborah Wainwright, Anna Verzone, and Carmen Reed. The views or opinions expressed in this presentation are solely those of the authors and do not necessarily reflect the views or opinions of International University. The United States is the only developed country that doesn't guarantee paid leave for workers who are new parents. The United States lags far behind in financial support for parental leave. Canada, France, and the Netherlands all offer over 15 weeks, and the UK offers 40 weeks. In the United States, the Family Medical Leave Act gives workers the right to 12 weeks of unpaid leave, and only if the company meets certain conditions. The Family and Medical Leave Act, or FMLA, was enacted in 1993 to grant up to 12 weeks of unpaid job-protected leave to eligible employees who need to care for their children or other family members. Unfortunately, there hasn't been much federal legislation designated to supporting working families since this time. The consequences are shocking. Only 12% of workers have access to paid family leave through employers. Less than half of all workers are covered by unpaid leave. 25% of women either quit or are let go when they have a baby. Of those who only get partial pay or nothing at all, a third borrow money and or dip into their savings. 15% go on to public assistance. While many may think of parental leave as only additional costs, there are several ways that it ultimately leads to increasing economic and social benefits. 3 states, California, New Jersey, and Rhode Island, offer guaranteed paid leave, and these programs are funded by the employee's payroll deductions. Because California's paid family leave program is 10 years old and New Jersey's program was instituted in 2009, there is a body of research about the financial impact of paid family leave. Paid family leave programs financed by payroll deductions cost individual employees less than $1 a week, and having state-mandated paid family leave hasn't hurt most employers' bottom lines. In a survey of California business owners, 89 to 99% said the program has had positive or no negative effect on their profitability or performance. 78% of millennials are part of dual career couples. Fact, 38% of U.S. millennials would move to another country with paid parental leave benefits. Training new employees has been estimated to be 21% of the employee's annual salary, and even higher for more skilled labor. 86% of millennials are less likely to quit if paid parental leave is offered. 6 in 10 working moms say balancing job and family is difficult. The majority of moms and dads agree that working and having a family is very difficult to balance. Studies reveal that in European countries where paid parental leave is offered, there is an increased labor force participation from women and a decrease in unemployment. This leads to a boost in overall productivity. Paid parental leave can have outstanding effects on national economy. It can lower unemployment rates and more capital to be available to put back in the economy. It reduces reliance on public assistance. Women who return to work after taking a paid leave are 40% less likely to seek public assistance. There is a wide wage gap between men and women in the same jobs, and this is partially due to women having unpaid leaves from the workforce to have their children. With paid leave, women are able to build more tenure and experience in their jobs, and this will close the pay gap. Workers are more likely to maintain their pre-leave wage level if they stay at the same employer than if they must go find a new job. This can raise long-term lifetime earnings and contribute to the health of the economy. 6 months is found to be the optimal maternity leave to reduce postpartum depression. The cost per year of a mother to be treated for postpartum depression is $7,200, and the estimated total loss in the United States is $5.7 billion, and this includes cost of treatment and loss of productivity for mothers that are unable to work due to postpartum depression. For infants, the mothers receive paid maternity leave, and they have slightly higher birth rates and lower incidence of preterm birth. Every month of paid maternity leave can reduce infant mortality rates by up to 13%. Longer periods of bonding can prevent behavioral and developmental delays, and children who are in daycare are more prone to illnesses, which will cause decreased productivity for parents having to stay out of work. Preterm birth results in a loss of $26 billion a year in the United States, and the average cost of child care for just one child is $10,468. The goal for breastfeeding in the United States is that 60.6% of babies should be breastfed at 6 months. In the U.S. currently, only 51.4% of babies were breastfed at 6 months. Full-time working mothers who received 12 weeks of paid maternity leave were 3 times more likely to breastfeed their babies and twice as likely to still be breastfeeding at 6 months than those who do not receive paid maternity leave. If 90% of infants in the United States were breastfed for 6 months, it would save $13 billion a year and save 911 lives. Direct and direct costs of care. Over $5 million could be saved in expenses just related to childhood illnesses alone.
For example, physical stress and mental stress can have devastating results on mother and baby. For example, low birth weights and early term births are associated with higher costs But with paid maternity leave, low births are decreased by 3.2%, and there is a decrease in early term births by 6.6%. Studies show that birth weight has a positive correlation with lifetime earnings, and with each 1% increase in birth weight, it has a direct effect on increasing one's income by 0.1%, and these benefits outweigh the cost of paid maternity leave. Studies have shown that the economy benefits from maternity leave by an increase in workers and there's less government assistance. Paid maternity leave also boosts the economy by increasing job commitment and increasing wages because it decreases the cost for replacement of employees. While the elite employees have coverage, the low-income workers are not getting paid maternity leave, and it is causing an even bigger gap between the elite and low-income workers in the United States. Paid maternity leave helps decrease costs in the long run by not driving families below the poverty line. Paid maternity leave has shown a decrease in infant and child mortality by 20%. You may be asking yourself, what does this exactly mean? It means that many lives are saved by paid maternity leave. If this has not convinced you that paid maternity leave matters, then I'd invite you to listen to the following story about Julie. Julie's a 31-year-old woman that worked as a secretary before she had her baby. However, she could not financially afford to have 12 weeks off with no pay. Her husband works, but both incomes are needed to make ends meet. Julie has had to return back to work after 4 weeks from when she had her baby. She experienced stress and maternal anxiety, and she eventually had to stop breastfeeding. She went into depression and eventually lost her job and had to go on public assistance for a short time. Julie made it through a depression and got another job with less pay. This happens more often than people think. Julie's story could have been very different if she'd had paid maternity leave. She could have continued to breastfeed, had better pay, an increase in her earnings in the long run, decreased health costs, and would not have had to go on public assistance. In the long run, her employer would have also benefited more because the employer would have had not lost money retraining a new employee. The answer is clear, and that is that paid maternity leave matters, not only to the person receiving it, but also to the employer, families, and the economy in positive ways. The time is long overdue for the United States to have paid maternity leave. It is time to take action and vote for paid maternity leave for all the states in the United States. Access for everyone for paid maternity leave will positively impact the economy and help with better health outcomes for families. Paid maternity leave is the answer and will impact your children and future generations to come. The choice is yours to make.